Good day. We would like to welcome you to our West Kendall Baptist Hospital Group Health Policy Analysis. My name is Lynette Acosta, and I currently work at Chen Senior Medical Center.
And my name is Barbara Arumagan, and I currently work with Cigna.
My name is Rachel Cavett, and I'm currently a full-time student.
Hi, my name is Nicole Rodriguez, and I currently work for the Miami Cancer Institute.
West Kendall Baptist Hospital is part hospital, part art hall exhibit, part teacher, part cafe, part hurricane refuge, and all community. Since its beginnings in 2011, West Kendall has embedded itself into the Miami-Dade County area as a hospital that provides exceptional service to its community in a number of ways. The hospital services an area that, before West Kendall was built, did not have an area hospital, which added to the burden of travel for many patients seeking care. West Kendall was successful from the start and exceeded budget predictions and began earning a profit ahead of schedule. That is, until a mix of external regulatory and reimbursement changes were imposed. And immediately, West Kendall found themselves seeking solutions for unanticipated problems related to revenue generation. The executive team decided on a plan to address the reimbursement issue, but also sought ways to earn alternative sources of revenue. This brings us to our problem statement. How can West Kendall partner with business and community members to generate additional revenue for the benefit of both, and how will we measure success? From the very beginning, West Kendall has turned to key leaders, both within the hospital and outside the hospital, to make sure they were best meeting community needs. Their pursuit towards additional revenue would be no different, and the following factors and key stakeholders have been identified. First up, legal factors. West Kendall will need to consider HIPAA and other privacy laws, especially with respect to electronic medical records. The consideration to enter into a partnership with other providers, for instance, will need ironclad legal oversight to reduce any liabilities with potential data breaches. Legal scrutiny will also need to be applied to antitrust laws to make sure that West Kendall has not unintentionally created a monopoly. Practical factors. Over the last decade, West Kendall has proven themselves to be a vital establishment in the community. They provide jobs, outreach, education, and seek to bring the community together in ways beyond healthcare. They have a strong reputation, and their ability to partner with other community leaders and business remains high. To maintain their standing, West Kendall will need to be vigilant in their pursuit and properly vet any potential partnerships to the fullest. They will need to make sure the partnership aligns culturally, that the commitment to provide quality patient care remains, and that community engagement continues to evolve with community needs. And lastly, economic factors. Because of its size and current influence within the community, the consideration for West Kendall to partner with other businesses and community members may have a negative impact on competition or other businesses in the community. However, if West Kendall cannot increase their revenue, it will impact the ability for West Kendall to operate at their fullest potential, which could affect the community at large and may negatively impact businesses within the community, for instance, if staff cannot access the care they need.
Thank you, Rachel. So we're going to be moving into option 1, expand primary care department. West Kendall Baptist Hospital's success lies in understanding its demographic and the needs of the community members. The preventative care and support needed to support a large community means West Kendall must have a growth plan. As such, option 1 includes an expansion project for the primary care department of the hospital. This expansion will allow West Kendall to meet the growing needs of its community members while generating additional revenue for West Kendall, while also increasing primary care availability for patients. West Kendall can leverage their primary care department to help reduce unnecessary hospital admissions and readmissions while prioritizing the availability of acute care. The first option requires choosing which primary care department will be at the forefront of expansion and how many patients will be served. There is value in focusing on geriatric primary care since 80% of the senior population carries one chronic disease and 77% carries two chronic diseases. Additionally, the baby boomers will reach retirement age in the next 10 years, which will increase healthcare utilization for this demographic. West Kendall is able to provide a direct stream of patients to the hospital if the patient's healthcare needs shifts from primary care setting to a hospital setting. Due to both locations using the same EMR system, high levels of communication and accessibility between departments will provide reassurance to staff that patient care is complete. Hospital readmissions will lessen and both departments will engage in a cycle that supports revenue growth. The second part for expanding the primary care department lies in the primary care physicians themselves. The challenge doesn't solely exist in recruitment efforts, but in the availability of PCPs for hire. The US is currently facing a shortage of PCPs, and the shortage is only expected to grow larger by 2033. It is estimated that they will reach a shortage of 55,200 PCPs. Primary care only accounts for 209,000 out of 624,434 United States specialties. This disparity can be attributed to the growing prestige placed on specialty care physicians versus primary care physicians. The CEO of the National Resident Matching Program, Mona Seiner, stated that it has become challenging to match fourth-year students with primary care specialties because of the lack of competitive income and the high demand work requirements. Primary care physicians are paid roughly half of what specialties make and are required to see a high volume of patients. In order for West Kendall to expand their primary care practice, they will need to partner with a reputable recruitment company who has had success matching healthcare organizations with talented primary care physicians. Recruiting companies tend to help organizations when their internal recruitment strategies need assistance or a broader networking approach is needed. Prominent recruitment companies include Merritt Hawkins, Ed Kisson, Search Consultants, Medicus Firm, and Mass Medical. According to one article, primary care physicians have ranked among the top 20 most requested recruiting assignments for the last 13 years. West Kendall may face the same challenge in its recruitment efforts and will need to be prepared to engage community in respect to salary, benefits package, and possible relocation expenses. So this option entails expanding the existing residence program for family medicine by partnering with multiple universities in the US. At this time, the program only takes about 4 residents per year. With a well-founded hospital system, West Kendall should invest in additional residents who could then directly feed into the primary care department. Adding additional residents would not, however, come at the cost of compromising West Kendall's high standards in either culture or operations. Students have shown that success in revenue comes from staff members' alignment and their engagement with the company. Gallup, a consulting company, analytically studied engagement and determined that those with high engagement at 22% are more profitable than those who are not. West Kendall residents would understand firsthand the regulations of both hospital and outpatient settings, ensuring the best care is provided in either setting. And now we move into option 2, our partnerships with primary care groups. Similar to option 1, the inclusion of preventative care led by PCPs will further help the hospital generate revenue and increase access for patients. Due to the burden placed on West Kendall in expanding an internal primary care department, this option partners with existing providers in the community. Working with community primary care providers allows for 2 revenue lines: diversion of acute patients to the hospital and strong marketing. Per the West Kendall case, hospital physicians in the observation department have difficulty classifying the diagnosis of patients, and when faced with claims, deductions were made due to regulations. The primary problem with incorrect documentation lies in the unknown. Hospital physicians are faced with new challenges every day, and the unknown history of a patient's health and the inaccuracy of self-reporting do not assist physicians in the understanding of a patient's condition. Partnerships with primary care providers would allow for an opportunity to share patient information to reduce waste and unnecessary duplication of services, while also allowing hospital physicians to justify their admissions accurately. For example, creating a memorandum of understanding with clauses to promptly complete releases of records, as well as rights to hospital admission information, nurse case management rights to the hospital, and even a clause to ensure outpatient continuity of care to promote the reduction of readmissions. By partnering with existing community providers, a larger workforce is created to instill a better health environment for the West Kendall community. while also reducing the risk of inappropriate diagnostic deduction. By increasing data and reducing incorrect input at the hospital level, there are possibilities to improve revenue. Overall, the second option is less costly than option one, as its investments are made in outreach through partnering with existing primary care providers, which would help bridge the disconnect between primary care providers in the area and West Kendall Hospital. There are many EMR systems now available, and advances in sharing patient health information shows that the operative coordination should not be a significant challenge as the industry suggests. Significant efforts and investments should be placed on creating ways to efficiently share information between primary care clinics and hospitals to reduce medical waste, readmissions, and increase revenue lines through partnership contracts and consent.
I will go ahead and talk about the scorecard visibility and accessibility as option 3. The third option explores accessibility and visibility to different forms of scorecards throughout West Kendall. This would help enhance efficiencies that promote better revenue outcomes. A partnership with Microsoft Power BI would help align the employees who are indeed the revenue drivers of the West Kendall operation. Making a universal scorecard that covers the main drivers to revenue while trying to back to the mission, vision, and value of West Kendall would help the employees meet specific goals. Though West Kendall's existing scorecards are very helpful to management and executive levels, those who work on the entry-level positions really understand what they're being presented, and the entry-level team does not need to be aware that they are revenue drivers. Instead, their goal is to provide exceptional Pineapple Way experience. The everyday communication that speaks to a nurse, a receptionist, a physician, or even a housekeeper is that their role helps keep patients healthy. If they can measure their success or how they impact success, it would help improve their service delivery. Creating scorecards is no easy task. Since visuals take expertise, creating partnership with Power BI program would help facilitate implementation. Power BI is a program created by Microsoft that collects software services, apps, and connections that can create a coherent, visually immersive, and interactive insight with the data sources collected. Power BI allows the individual organization to import data from an Excel sheet, a cloud-based system, or an on-premises hybrid data warehouse. With the data collected, the software allows the user to visualize and discover what is important and share with whoever they please. Power BI also includes a Power Query, which extracts and transforms, and a Power Pivot is used to model and analyze. Power View and the map is used to help visualize the data. Power BI can be extremely beneficial in a healthcare setting because it can help with the data from an EMR system, including a CMR, HMS, outpatient registration, labs, pharmacy reports, claims, patient billing, memberships, and more. Implementing the software at West Kendall can help in cost savings as pertains to patient care, equity, readmission levels, and etc. It can help West Kendall take their data and export it by creating visualizations for KPIs. Using Power BI can help visualize healthcare metrics such as clinical, hospital, patient, and physician dashboard. There are many advantages as to why a scorecard platform such as Power BI should be implemented at West Kendall. The scorecards can be tailored to West Kendall's specific values, goals, financials, management, strategic planning system, and much more. The challenge West Kendall may have in its implementation, as with any organization, change is challenging to adapt. A scorecard requires buy-in from leadership to be successful and implemented from the bottom to the top. Every entry-level employees to executives. The key to successful implementation is repetition and teaching. There will be a learning curve. It takes time and dedication to implement a scorecard. A scorecard does not require management and patient-facing team members to come together and log data, which can be time-consuming. The data is generated directly from the EMR system and the databases the West Kendall already secures. This option takes comprehensive implementation, yet will also support the hospital should the industry shift toward a more massive value-based reimbursement structure. Hiring consultants would be a challenge as adapting to the Pineapple Way will be quite tricky. The understanding of the company aids in the significant creation of the scorecards. It also requires long-term continuity and maintenance, as West Kendall Baptist will need to change their scorecards based on the changes in regulation or community needs. Overall, option 3 is a long-term investment, and its success in the inclusion of the complete workforce toward achieving the mission, value, and vision of West Kendall, which making it available and accessible to view in real time to all team members in common areas will allow for higher awareness and motivation. These visualizations will be tailored to the ordinary employee with target-specific KPIs.
Thank you, Nicole and Lynette. After careful review of all options, our team recommends option 1, expanding primary care services. West Kendall stands to generate additional revenue while benefiting community members through increased access to care, particularly for West Kendall senior population. The expansion will give the hospital another reliable revenue stream and meet community objectives. The community requested quality healthcare in closer proximity, focusing on primary healthcare. The primary care department currently has 36 primary physicians. The West Kendall community is projected to grow approximately 7% to 375,900 within 5 years. With this type of growth, the need for primary care is significant. Of this population, 13% will be individuals above 65 years old. As individuals age, they require more primary care services, both as preventative measures for chronic illnesses and addressing complications arising from chronic diseases. The hospital is already equipped to accommodate the expansion, and no design changes will be necessary, which is significant financial incentive for this option. Additionally, both locations, primary care clinic and hospital, will utilize the same EMR system, allowing West Kendall quick access to patient charts while avoiding duplicative services, a benefit to both the hospital and the patient by way of increased revenue through waste reduction and precision of care through patient record access, respectively. Along with the decision to expand the primary care department, West Kendall will need to consider ways to implement effective management techniques that engage patients, clinicians, and family caregivers in collaborating to identify patient needs and ways of implementing individualized care plans. Individualized care plans are instrumental in achieving higher value. Given the shift from volume-based to value-based reimbursements, this engagement will ensure high satisfaction rates among patients and predictable outcomes, facilitating better reimbursements. Considerations will also need to be given to recruitment and hiring of additional PCPs. In order for West Kendall to remain amongst the top rated healthcare facilities, it will need to be strategic and competitive in their efforts. The hospital could expand its revenue further through primary healthcare by extending practice hours. For example, offering weekend and evening appointments can elevate patient satisfaction and attract more patients to the facility. West Kendall can achieve these goals by reorganizing physician and staff schedules to reflect the extended hours. Additionally, it can offer expanded or new services to create alternative revenue streams. The additional services may include joint injections and simple fracture cares, or in-office lab testing. West Kendall can also increase its revenue stream by leveraging cost-effective marketing campaigns such as screening days, health fairs, and implementing patient surveys to make patients part of the turnaround process. West Kendall should measure profitability at the service and patient level. Financial and clinical staff should deliberate on possible opportunities to finance or adjust to improve profitability and maintain patient satisfaction levels. In this regard, the hospital should measure the profitability services per patient to facilitate a higher profitability migration. West Kendall Baptist Hospital's ability to lead, plan, and execute has made them an invaluable part of the community. Expanding their primary care services will make way for renewed pride and importance amongst PCPs for their distinct role in healthcare, helping not only West Kendall's community, but communities around the nation. For it is truly a collective effort that will allow West Kendall to continue paving the way for excellent healthcare and inspiring others along the way.
Thank you for your time today. It was an honor to engage with West Kendall in this unique way, and we look forward to hearing any questions or comments you may have.